Health Department has set its budget for the year at about 59.4 billion rand. The department has also been met with a series of issues relating to poor infrastructure, staff shortages and overcrowding, issues I'm sure you're well versed with now. But experts are also warning that without proper analysis of these issues, it's unlikely that the allocated budget will be helpful. Let's unpack this for you now. Bring in the Progressive Health Forum's Dr. Aslam, who joins us via our video link. And Doc, it's always great to have you on the program. Thank you indeed for making time. Many of us are also still digesting that open letter, as it were, from Dr. Tim de Meyer, who's a pediatrician, I understand, at Rahima Musa Mother and Child Hospital, essentially painting a bleak picture about what's actually taking place within the walls of that institution and how the people who are leading it seem so far removed from that reality. In what ways do you reckon that really complicates how we respond to these issues in the health department when it feels like the people at the helm don't really understand the issues on the ground?
Good morning. Thank you for inviting me. Look, you know, there's a fundamental concept. Your budget must meet the reality of the service you intend to provide. There's a huge disconnect here. And you raised the issue immediately about the letter from the pediatrician at Rahima Musa. Well, the response to that was a very blithe comment that, in fact, there have been no deaths. You are telling this to health workers in that facility in whose arms these children have died. And you're saying to the world that there were no deaths. Now, when you have this kind of disconnect, it's not surprising that you have this sort of budget that's supposed to deal with health services in Gauteng that are in crisis. But this is no crisis budget. This is a rather strange budget. The allocations are separated in various ways. We have, for example, nothing for health services, which is the bread and butter of this department. We have a solid allocation for compensation of staff, but you know, then there's a separation between COVID HR and normal HR. And these are huge budget line items that we have no idea how they were reached and how it's going to be spent. And if I may, let me contrast this so just to give viewers an understanding of why I say this. Johannesburg passed a budget a few days ago. That budget allocated the largest portion of it to city power because the city's major crisis right now is not enough electricity generation. So far, so logical. The second thing, the second biggest portion of the budget went to water reticulation. Again, it's facing the reality that Johannesburg suffers huge water shortages. So that's a budget that seems to address the accepted crisis that we all know. This health budget is you know, it's presented as though there is no crisis in the health system. And you and I both know, and every viewer knows, our hospitals are in a state of collapse. This ruinous management of it is blithely ignored, and we are now offered this strange budget. People are really concerned that our services won't survive this year with this sort of management.
Yeah, and it's also quite uncharacteristic, isn't it, Dr. Dasoo, for a doctor who's clearly got a lot on their plate to take time out to put together the kind of letter that Dr. Tim has and to send it out, given what's at stake, even around potentially the sanctions that he might suffer on the back of that. It does give off the idea that the situation has reached untenable levels that it hasn't before.
Well, you've said it, and I agree fully with that. Look, what Dr. de Meyer did was to channel the views of thousands of health professionals who work in the system under severe stress. And the reaction, I'll give you the other example, where the same clinician who said that there's no such thing as babies dying here because of a lack of services, was the same one who said that the reason health workers buy bread for patients, as we heard recently at Barra, was because they have a caring side, nothing to do with the facility. So what you're dealing with here is a propagandist approach that seems to treat us all as fools. How stupid do they think we are? We can all see this system collapsing around our ears. Charlotte Maxeke is a poster child of how not to run a health service. For over a year, the Department of Infrastructure and the Department of Health bickered over who should pay for the repairs. They did nothing about it. In the meantime, a major cog in a vast and complicated system of healthcare is dysfunctional. What do you think is going to happen to the rest of the machine? Well, it has happened. The medieval horrors that we witnessed in Helen Joseph Hospital, which picked up all the psychiatric cases from Charlotte Maxeke, is a case in point. This is replicated on a daily basis. The Gauteng Department of Health is not capable of providing health services to the most industrialized region on this continent. That is now a bare fact. We have asked, and a lot of organizations have come together for a joint accountability and monitoring of fixing Charlotte Maxeke. This has been rebuffed. In fact, the medical school is at sixes and sevens over this. The entire training platform is at risk because of what has happened. So we do face an untenable situation. I don't understand why the powers that be cannot see this. Those in charge of the Gauteng provincial government should have placed this department under administration months ago so that we could have at least have some stability in the system. None of that has occurred.
At which level, if there are any that stand out to you, Dr. Dasoo, is the disconnect most stark? I mean, you've got leaders, of course, at provincial level who are meant to oversee broadly what takes place in the department, but you've also got CEOs and other administrators within the institutions who too should be answering some tough questions. As far as you're concerned, is it a matter of all those, I guess, leaders throughout that strata not really knowing what's taking place, or is there a particular place where there's a bottleneck effect, for lack of a better term?
Look, I think it's the system of the governance that's a problem. The CEO is part of the administration. The CEO's ability to even fix a broken window is seriously attenuated because they can't do it. It's a public works issue or something like that. So blaming the CEOs of the facilities alone doesn't help at all. The problem starts at the very top, where there is a serious dearth of understanding of what the complexities of the system is. Now, we've had this before. They have appointed MECs who had no clue about how to run a modern a system like we have in Gauteng, around health. We saw the disasters that attended appointing people who have no ability to manage this. So it's the way the government is organized, and it's the way the systems are run, and the way the budgeting is done. There is, as you mentioned, a huge amount of unhappiness among health workers, which they cannot channel to any real authority that can do anything about it. They are victimized, they are scared to speak out, but I'm pleased to say that there appears to be a great deal of momentum now. You see Dr. De Meyer's letter, there are many other health workers speaking out. And I think without that, this government will not listen. They believe they know what they're doing, they believe they're doing the right thing, they refuse to see the reality for what it is, and they budget accordingly. We have to move away from this kind of system. There's not one bottleneck, there's an entire systemic failure of governance of health in this province.
Sure. Of course, there are clinicians that are able to garner enough courage to speak out like Dr. De Meyer. There are others who choose to walk away, and we can't really blame them for that, given the picture you've just painted. How much of the threat is the latter to the sustenance, dare I say, even the survival of the health department, especially when you consider the number of people who rely on public health services and who need them to work as efficiently as they can?
Well, again, you've said it. It's a huge threat as health workers, from burnout, from an inability to do their jobs properly, leave the system. The system is already constrained. We already have a shortage of health staff across all levels. And the increased attrition rate is not helping at all, because what happens is that when they leave, those posts are frozen because there's no money for some reason to replace the person who has left. And it's this continuous demolition of even the compensation budget that is really alarming. Over the years, there has been defunding of public health care, and the government must take responsibility for this. But when you issue a budget that seems to be constrained, to the extent that if someone leaves, you cannot replace that person. You have a direct impact on services. The other staff have to then pick up the slack. They will burn out sooner. They will then leave. And so the cycle becomes vicious. And unless there's leadership at the top that understands this basic issue, we are not going to get anywhere. So it's an indictment. It's a real worry. I don't know how to fix that. None of us outside of the government have the ability to do anything about it because, that's what the government does. And until and unless they accept that they don't know what they are doing, we are going to have this problem. And I'll put one more thing to you. The other provinces have differing levels of efficiency, we know. So take the Western Cape. They don't seem to have these problems as Gauteng does. And Gauteng has a bigger budget. Gauteng has more resources. Now, why is that? We must ask the hard questions. There's nothing to be afraid of here. Our people's lives are at stake. So ask those questions. And I think the media has a big responsibility here to continue putting this to the leadership. There is nothing that they have been able to say thus far that gives us any comfort that they accept that there is a crisis and that they are willing to do something about it.
Fair enough. On that sober note, we'll have to leave it. Dr. Aslam Dasoo, thanks very much indeed for speaking to us. Dr. Dasoo is with the Progressive Health Forum. I appreciate your time.